Hello, this is Terry Yates Spear, and this is my mom, Jane Ofer, and she has agreed to be my patient during my 15-minute skill video. And in this video, I'd like to try to teach you, and I'm also trying to teach my mom, how to take a manual blood pressure. This is a really important skill and one that requires actually a lot of practice so that you can become proficient with it. Blood pressure is very important as far as good perfusion. You don't want to have too low of a blood pressure or you're not getting good perfusion. And then you certainly don't want to have blood pressure too high. You run the risk of a cardiovascular accident, for example, a stroke. And so knowing how to take a manual blood pressure, very basic skill, but very important. And there are two ways that you can do that, by palpation and by auscultation, and we're going to do both today. So you must have a blood pressure cuff, and important things on your cuff are your gauge. And the gauge, you see the numbers run 0 and 20, 40, 60, 80 on around. And then you have a longer black line that is your 10. So 0, 10, 20 is your next number. A line is 30 and then a number 40 and so on. The smaller lines are increments of 2. And so blood pressures are always positive numbers. Not positive, wrong. Even numbers. They're always even numbers and never odd. So you want to check your gauge, make sure that your needle is in the little box at the bottom, and that means that it's calibrated and ready to go. If it's not calibrated, you simply take some pliers and put on the place where the hose attaches. There's a little metal piece, and you can actually grab it and turn this way or that to recalibrate it. Other thing that's really important about your cuff is that it be the right size for your patient. If the cuff is too small, then you'll get a false high. If the cuff is too large, you'll get a false low. So the cuffs are marked. The end of the cuff is your index, and you have a range. You see the 2 white lines there. When you put this around the patient's arm, this index should fall somewhere within those 2 white lines, and that way you know you've got the right size cuff. So we're going to go ahead and do the blood pressure by palpation. 2 reasons that it's important to know how to do this. Number one, you can do this if you have time. You can do a blood pressure by palpation, and it's going to give you that systolic number, the top number in your reading. And then if I follow that with auscultation, I know about what the systolic is, and so I don't over inflate my cuff, which helps to decrease my patient's discomfort, because blood pressure cuffs get tight and it's uncomfortable. So if we know that we're at 120 by palpation, I'm not going to go up to 180 or 160. I'm going to be able to go on up maybe 130 or 40 at the most to get my auscultated blood pressure. So that's one reason. And then the second reason that it's important is because sometimes you might be in a really noisy environment. It could be the back of your truck is really noisy. It could be you're on scene and it's really noisy, and you simply won't be able to hear. And so getting this blood pressure by palpation, very important. And you will only get the systolic number, and you will record that over P. And that's your blood pressure reading. So Miss Ofer, if it's all right with you, I'd like to go ahead and take your blood pressure by palpation.
Certainly.
All right. Is it okay if I use your right arm?
Yes.
All right. So we're going to put our cuff on the arm above the elbow. And you just want to put your cuff on and snug it up. And the cuffs usually have a place that shows you where it has an arrow that shows you where you should be on the inside of the elbow. You should be able to see your dial or your gauge. So we've got our cuff on, and by palpation, step 2 is to find the radial pulse. And once you've located the radial pulse, what you're going to do is pump this cuff up to about 70, and then go on up 80, 90, 100 by increments of 10 until you lose that radial pulse. And then you'll slowly let a little air out here. And as the needle starts to descend, as soon as you feel that radial pulse again, that's the number you record. That'll be your systolic pressure. So I'm going to find your radial pulse. And the good news is,
I don't have.
You do have one. The good news is you do have one, ma'am. All right. And we're going to go ahead and pump up our cuff, and we're going to hit 70. I can still feel the pulse. 80. I feel the pulse. 90. I feel the pulse. 100. I still feel the pulse. 110. I can still feel it. Now I just lost it at about 120. So I'm going to slowly let some air out. And I regain the pulse at about 116. So I'm going to write down 116 over P. So systolic blood pressure, 116. So I'm going to let all my air out. Was that too uncomfortable?
No, that's fine.
You're an excellent patient. Thank you. All right. Good job. I don't want to pinch you. There we go. All right. Now, let's see if Miss Ofer can take my blood pressure by palpation. Hopefully, she has listened and got all the steps down. We've checked. Calibration is good. We know that it will inflate and deflate. I'll go ahead and turn it right so it's closed and ready for you to pump up. Okay?
I believe that was just to tell you the steps.
Okay, go ahead. Tell me the steps.
I'm going to put your cuff on. We've already checked the calibration.
Okay.
And you've already turned it to the right.
Okay.
So it's ready to inflate. I don't believe that's quite high enough.
Okay.
Let's get that exactly where we
All right,
want it.
look at your arrows. Because you want your arrows over the middle of my elbow. Mm-hmm. And you asked, did you ask me about, is it okay to use this arm?
I certainly did.
Okay, there you go. It's fine to use this left arm.
Thank you.
Okay, you're welcome. Thank you.
The next thing to do is find out if this lady has a pulse.
I hope I have a radial pulse. If I don't, we're in a lot of trouble. Okay, you locate the radial pulse. And for folks who honestly are just starting out, whether it's finding a pulse, doing these manual blood pressures, no, this stuff takes practice. You can't feel enough people's pulses to get. I mean, just you have to ask, can I check your pulse real quick, and get really proficient with finding their pulse at the wrist, finding that radial pulse very quickly. And same thing with doing the blood pressures. You just have to ask folks, can I check your blood pressure real quickly? Most people are happy to oblige and help you. You cannot practice it enough. So you want it to become easy as far as being just a second nature to you. You located the pulse?
Yes.
All right. Good deal. Good deal. I'm glad to know I have one. Okay.
And most of the time your patient will be still and not talk.
Oh. Okay, so you're inflating.
70.
Okay, you can still feel the pulse. So you just keep going by increments of 10.
Okay, I don't have
Right on up.
pulse.
All right, where are you now?
120.
All right, go ahead. Go ahead. You've lost the pulse at 120? Go on up to 130. And then just slowly let your air out. You shouldn't be feeling a pulse at anything above where you lost it. And then as you crack that just a little bit, you pay attention to where the needle is on the gauge when you regain the pulse. There you go. Good job.
Had the pulse.
Okay, great.
And that was at about 114.
114?
Mm-hmm.
Okay, all right, that's
So I
fine.
would write down 114 over P.
Yes, you would. Yes, you would. You would write down 114 over P, and let's let this air out of here. Whew. They are tight. That was a good job.
Thank you.
Very nice. Very nice. All
You were a
right.
very
So
good patient.
hopefully in a classroom, if I had any questions or anything, I would ask. Now, do you have any questions on this? And we would practice this skill again and again. The other method of taking the blood pressure manually involves auscultation, which involves the use of the stethoscope, and it starts the same as far as applying the cuff. One thing about your stethoscope, it bears to say the simple little things you think people know, but maybe if you're brand new, you don't know. But when you have your stethoscope, you see how your earpieces are bent one way, or they kind of are pointing. You want to put your stethoscope on so that these are to the front, pointing to the front. Don't put it on with them pointing to the back, to the front. All right, so I'm going to put that right there. And we're now going to take the blood pressure by auscultation. Auscultate means to listen. May I put this on your right arm?
Yes.
All right, I'm going to take your blood pressure, ma'am. And so we're going to put that snug as we can. Okay, and just relax your arm. Just relax. There you go. Okay, no more feeling for a radial pulse at this point. What I will do is put my stethoscope up here in the elbow, the AC. And I will inflate this cuff. Now I know that her systolic over palp was 116.
14.
I was 114.
Yes,
You were
I'm
116.
sorry. Yes.
Mm-hmm. So I'm going to go ahead and inflate up to about 130 or so. And then that, as I let my air out, the first thump that I hear will be my systolic. And I'll listen. My last thump that I hear will be my diastolic. Okay, just relax. So tighten up, inflate. We're going to go up to about 130. Okay. So I heard my first thump at 122 and my last thump at 80. So her blood pressure by auscultation is 122 over 80. Very nice. Let all the air out. There we go. And we weren't too far off. By palpation is not necessarily the most accurate. By auscultation is more accurate, but it certainly does give you an area to begin so you don't overinflate that cuff. All right, Miss Oprah, you want to give me you want to try?
Certainly.
All right. And if you want to just walk through the steps, that's fine.
Well, I'm going to ask you, of course, if I might put this on your right arm.
Yes, ma'am.
It's
Left
still
arm.
in calibration.
Mm-hmm.
I'm sorry, left arm.
Mm-hmm.
And I want to be sure I have it properly aligned.
Mm-hmm.
Bringing this around. Snug, but not pinching. And I'm going to find my bulb. I'm going to go ahead
Mm-hmm.
Meantime, I'm going to put these on, and they need to be pointing in
That way.
this way.
Mm-hmm. You want them pointing to the front
To the front.
of your, like your face. Mm-hmm. Mm-hmm.
I don't have to find the pulse because I'm using this.
Mm-hmm. Mm-hmm. Good deal. You don't need the pulse at all. So, what do you do now?
Right, my bulb.
Mm-hmm. Find your bulb. Good deal. It's already
It's
tight.
tight.
Uh-huh.
I know that the other method was 116, so I'm going to go on up to about 130.
Mm-hmm. Good deal.
And then I'm going to slowly crack.
Mm-hmm. You really closed it good, didn't you? You want me to help you?
And her blood pressure was 125/80.
Except we don't have any odd
At
numbers.
126. I'm sorry, it was 126. I misspoke. Thank you.
Thank you. 126/80. Okay, let the air out.
So it varied a little bit more because you were 116 on the other.
And it's usually a little more accurate by auscultation, and it's important to practice. The blood pressure over palpation can be difficult if you haven't practiced obtaining that radial pulse. You know, getting good at finding that radial pulse rather quickly. And then just practice. So if you have any questions, I suppose you can text or email me, and I'll be happy to try to answer those. Thank you to my mom, and she's done a great job. In the event of a medical emergency, she knows how to use these two pieces of equipment, I hope. So thank you for that, Mom.
And if they want my autograph, I'll be glad to give it.
Okay, and she will sign autographs if you want. Okay, thank you so much for watching. Bye.